Well, good morning everyone. Right, it's Keith, Ian, Dad, Grandad, you know the routine. Right, all sorts of things to say. Not quite sure where to start. Hopefully you can see me alright. Yeah, where do I start? All sorts of things going around in my head. Today is the 3 weeks since I had my 5th chemo, and today I should be having my final 6th. But as from you probably saw in the last video, I've had a terrible time of it this last 3 weeks. Normally, first week is rough, you sleep a lot. Second week, you start to recover and you feel a lot better by the end of the second week. And during the second week, you're doing little jobs and things. And then the third week, just like normal, back to normal. Not this time, no way. First week, like normal. Second week, just didn't recover. And I told you the story in the last one where I went to the hospital, bloods and things. And I've never been as exhausted in my life. Anyway, we went out end of last week, which was like 2.5 weeks, went out with the camper for a few nights. And believe it or not, it wasn't until we got home yesterday, which is like the end of the 3 weeks, I actually went to bring the dustbin in and I got stamina. I actually walked at normal speed. I mean, previously I've been sort of walking really, really slow. You wouldn't believe it. If I was sat here and I bent down to put my shoes on, I'd be afterwards just gasping for breath. And the weirdest thing about it, and my sister sent me a little message after the last one because she's had lung problems all her life. And she said, "Welcome to my world." And yeah, I empathise. I know what you're going through, Jane. But the weird thing about it is, I'm talking a little bit quiet because my wife's asleep, so I don't want to disturb her. It's early morning, it's coming up 7 o'clock. Yeah, the weird thing is that I test my bloods and things on my finger with, the little machine. This thing. Just put it on my finger. And you've had them at the doctors, I'm sure. And it was showing like 98, 99, even 100%. It's because I was breathing that much. But for some reason, the oxygen that was in my blood wasn't getting. And I'd get up from here, I'd be laid on the couch here, and I'd walk into the kitchen to get some water, and I'd have to put my head down on my hands on the worktop, and because I was feeling like I was going to pass out. But anyway, hopefully all that's passing. So the story is that I went to see, as is normal before me chemo, I went to see the oncologist, the consultant, last Thursday. Today is Tuesday. And you've got to be honest, I told him exactly what I've been going through, everything else. And he said, right, we've got 3 options. We can cancel your final chemo, I've finished, no more. We can give you a low dose this time. He says, or we can postpone it for a week, see how you go. So now, me being me, I'm sort of bull-headed and get in there. I want to push forward. My boss always used to say, I've got a can-do attitude because I can do it. Don't matter what it is, I can do it. Just apply your noggin a bit. Anyway, so Yeah, so I was basically saying that, no, oh no, I want to go through it, I want to ring that bloody bell. so I didn't say that to him, but that's what's going through my head, I want to push forward. And he's saying, well, I won't advise it, you could end up a lot worse off. And then my brain clicked in, what the bloody hell am I saying? He's a specialist, and I'm trying to tell him how to do his job. But at the end of the day, it is my choice. And so at the end I says, look, I'm being stupid. I need to follow your advice. And if your advice is we delay it a week, we delay it a week, I've done. So I'm in the process now. I've got to go and get blood tests done at the doctor's. I've got to get new appointments organised for my next one. And I'm going to do that today. But the other interesting thing that he said, which, could interest you all, he said, sorry about cutting top of my head off. I feel better where I can see you better. Anyway, I tell you what, let me just, sorry. How's that? Yeah, that's a bit better, look. The thing that he explained, he says, what we've done with you, having both first generation, second generation, anti therapy, the testosterone, and chemo straight away, he says, it's not normal. He says, and then he mentioned his name, something like, it began with A. I can't remember what the word was now, but it was a name. It was like Alicia or something like that. There were these, let's call them Alicia trials done, which showed that if you, with what you have, which is obviously stage 4 advanced metastatic prostate cancer, where you've got tumours and things around your body, he said that it's been shown that by doing what we've done with you, having the chemo and the antigen therapies all together right at the start, he says you get a much better outcome long term. He says, you live longer before it all starts to come rolling back. So fingers crossed. It's good on him, and the other thing that he said was that now with the chemotherapy, he says the first 4 sessions that you have the maximum effect. He says after the 4th, the 5th and the 6th have a much more diminished effect. So, if you imagine if the first 4 give you this benefit, you're only getting this amount of benefit, and the last one you get even a little bit less. So he says it's not as important. But I asked him then the question, I said, well, when the chemo's finished and I'm just on the hormone treatment, will that continue to reduce the PSA, to continue to, attack the cancer? And he said, oh yeah, he says, normally, he says, we wouldn't give the chemo with the antigen therapy all at the same time. He said, we just give you 2 lots of, antigen therapies, first gen, second gen. He says, and that would do it. He says, but, it's bells and whistles with you because it's advanced. And obviously, it's spread and 4 tumours on my spine and all the rest. Excuse me, slurp. So they always give you a blood test afterwards, which I've now found the results from. And I'm sorry to be rattling on, but I'm lots of things to cover. So there was a big queue. So you all sit outside nice and quiet. They call you in one at a time. And the lady that was doing it, I had last time. So I've been sat there probably 3/4 of an hour waiting. and eventually got called in, and going through the usual procedure. You know, I'm sure you've all had bloods took. But I can't remember how, but we got talking, and that was it. She was saying how some men feel that with nurses that they've got a right to touch, you know, to hug and kiss even, you know. And I'm astounded. So, I mean, I would say, I've got no wishes to do that because I've got no testosterone. I've got nothing at all. No desires, no nothing. And I didn't know whether to spend 5 minutes on that issue because it's weird. You know, I mean, literally, I couldn't care less. You know, if she was stood there in nude and said, do you want me or a glass of water? I'd say half pint or pint. Because just nothing. At 7 o'clock. 5, 6, 7. There you go. Yeah, so, and for people that haven't experienced it, it's weird. And because, I mean, I was thinking like, because I was more or less saying to her, they should give these bloody blokes who have, you know, sex, you know, whatever problems, they should give them what I'm on. And then, of course, you know, last night, Hugh Edwards, that's bloody ridiculous. 6 months and 7 years. What's he going to do afterwards? He's going to end up bloody chasing kids around again afterwards. Give him, you know, put him through courts, give him the bloody, make him have the tablets, chemical castration, and he'll never be interested again. Anyway, I'm going off the subject. So we end up in this, you know, having the bloods took, phlebotomist of the corn, good word. And we're rolling with laughter because it turns out that she's had cancer, and I'm not going to go into details because she'll probably be watching this. So, because I gave it details, so I'm hoping you're watching it, you know. Enjoy it as well because it's brilliant. You know, when you can do that, it helps me and hopefully it helped her because, you know, she was explaining that I'm trying to be, you know, not be too divulgent here. But obviously she's had cancer, she's had it treated and she'd thought that she got rid, but it looks like now it might be returning, you know, and in more serious ways, and she's waiting for results and, you know, going through the procedure. So she's in a, you know, and I'm there and I'm thinking, oh, you know, that's terrible, you know, to have gone through all that and then for it to be coming back like that. So of course I'm empathising with her, and of course I'm trying to cheer up, and I'm saying, oh, you know, I'm sure it'll be okay for you and all the rest, you know. And then I thought, well, and I said, you know, mine's terminal. And she, oh dear, you know. So, of course, what I'm trying to do is I'm trying to say to her, you know, you think you don't worry about what you're going through. Think, you know, what I have to go through. But on the other hand, she's a lot younger than me. I'm 70, you know, I'm ready for the scrap heap. But she looked, you know, probably in her 40s or something, and she'll go, ooh, she hears that. She'll say, ooh, I'm only looking like 40-year-old. But no, I mean, we were smiling, laughing and joking because we were talking about all the effects and side effects and, you know, and drugs that you're on and all the rest. So, and of course I walked out, she's got a big chuckle and smile going off. As I opened the door, because all the waiting people are sat outside, and I've got this big grin on my face, smiling, and they're all looking up at me thinking, what the bloody hell are you on? Because I'm sort of, you know, I've got a big smile on me walking down the corridor, and it helps, it works, you know, that attitude. I'm drinking my tea. It says, simply the best, Grandad. I always thought it was the world's best, but there we go. Two things I wanted to sort of impart, if that's the right word, dispart. I don't know, probably a new word. Put it in the English dictionary quick. Two things I want to get across is that when you got cancer, your brain, you get into all sorts of spirals and things, and thinking and this and that and the other, because I talked to the consultant about what happens next and all the rest, but anyway, I'm going off on subjects. Two things: how to relax, how to control your breathing, and how to control your body from your heart, your blood pressure. Because advantage of having one of these is you can actually see what your heart's doing in terms of heart rate, and I've got one of these things on your wrist for your blood pressure. Two techniques. The first one is for your heart rate and your blood pressure, and I've done this at one of the chemo sessions. I went in, I think it was about the third chemo, and they did the blood pressure, and it was like 160 over 110. And my blood pressure is normally 125 over 75. And she said, "Oh no, that's too high. We can't continue with your blood pressure that high." So I said, "Hang on a minute." So I just sat back in the chair and closed my eyes and went through this procedure. And I said, "I can bring it down. I'll fetch it down for you." So she gave it like a minute, and I'm going through this procedure. And she tested it again. She says, "Oh, it's lower." She says, "But still, it was like 140 over 100 or something." So I said, "Okay, no problem." So I just laid there and sort of went through the mental procedure, and which I'll tell you what it is. And it ended up like 130 over 80. She said, "Yeah, that's fine. Okay, brilliant." She says, "Well done." And I'd fetched it right down. And it's all just about relaxation. And what you do is that you get yourself comfy in the most comfortable position that you like, wherever, in whatever way you want to do that. And close your eyes so you try and emit, external inputs. And all that you do is you concentrate 100% on your breathing. And you get your breathing slow and regular. And the way that I do it is I breathe in through my nose, go, nice and slow, and just concentrate on what's happening, your breathing. And you'll find that your heart rate comes right down. And I could do it now. If my heart rate was like 70, I could bring it down to 65, and I could watch it come down on the monitor. It's weird. And it just shows you the power of your brain over your body, what it can do. Now, the other thing is that when you're in this situation, and I've done this for years with other things, but you find that you can't sleep. And, your brain's going, and you're in bed. And the way that I do this to get back to sleep, and sometimes I've gone, is that, again, what I'm on is laying me back so that there isn't any pressure points anywhere. And I lay with my feet out straight, my arms down by my side, and my head back on the pillow. And again, I just close my eyes, and I literally, you can try and you clear your mind of what you've been sort of churning over. So, however you do that, but what the way that I do it then is I think about my big toe, and I start at my big toes, and I actually concentrate on my big toes, and relax them, let the muscles go, because you don't realise, but you tense when you're going through this. You're not relaxed, And once I've thought about my big toes and I feel that they're relaxed, I then think about my feet and do the same thing, and then my ankles, and then my lower legs, and of course you've got your calf muscles, and you think about relaxing, and any tension in you just let it go, let it relax, and then your upper legs, your thighs, and you do the same thing, and then you work up, and you think about like your stomach area and your muscles there and relax, and then your chest and shoulders, and you you just flop, and you think about your arms and hands, and you just totally relax, just thinking, totally relax, and then your neck, and then you just lay there in this totally relaxed state, and you just think about something pleasant, something really nice, something that you've done recently or that you enjoy or whatever. It might be stroking your dog or going for a walk, and you just remember that, and remember what it was like. Before you know it, you're asleep. Try it. Anyway, blimey, have I gone on what, 21 minutes, is it? Yeah, I have to get a big clock on there, just the big clock. No, it's tiny. And it's on its side, so I've got to do this one and read it. So, anyway, I'm not sure what else to say really. So hopefully my final chemo in a week. Hopefully, I don't know how it's going to affect me. I'm actually going to. I've not been exercising because I've just had that where you saw the video where I went for a walk. That's the one and only time I think I've been out. I've never experienced anything like it. Total loss of energy, no stamina at all. And and my wife gets, "What are you panting for?" Because literally, I was feeling exhausted. Anyway, right. Fancy another slip of my tea. Yeah, so otherwise, feeling a lot better now. As I said, I'm going to go up the shop this morning, see if some medicines have come in. Starting to think about some jobs I need to do around the house. Little bits of, tweaks here and there. Right, so hopefully another week and I'll be doing a video a week today showing you the ringing the bell. That'll be a little short I put on, I guess. Yeah, so not sure what else to say, except, of course, the usual. Life is a rich tapestry and it's up to you to make it colourful. Always. Yeah. Oh, that was something. When I was thinking about last night, and it's a little aside. When I was 17 or 18, I got rheumatic fever. And believe it or not, I was in bed for 9 months. I wasn't allowed out of bed. And all credit to my family, because I was living at home, of course. They moved my bed down into the lounge, and so I could sit, I could be, television and all the rest. And I was there in the lounge, literally day and night for 9 months. And it's appreciation of life, the point is I'm making. I sat there for 9 months, and I remember my mother got some daffodils, and I watched these daffodils go from a closed state and open up, and I literally spent, hours and hours and hours just watching these flowers. You might think I'm a bit sad, but because time changed its scale in terms of, what I was doing. And the other thing was that when people came in from outside, the smell, I could smell yeah, you know, like spring, or if somebody had been cutting grass, and I got that smell. And winter time, you know, when it's really cold and you've got that smell of snow in the air, and I smell that. Incredible. And I was thinking about my brother. He'd come and sit with me, and we'd play chess or cards and things, you know, and you know, and I still, you know, it's I get tearful. It's, you know, wonderful memory. What he did, you know, he just sat with me for hours and, you know, kept me entertained. But yeah, anyway, and going through what you go through with cancer is you begin to appreciate what's around you more, you know, the smells, the beauty of flowers. And all right, you don't sit in one place watching flowers bloom and, you know, watching leaves grow on trees outside and things. And I literally watched them, you know, I watched them bud and expand and come out and, you know, oh, weird. Not weird, but, you know, experience of life. Anyway, I suppose that's why I can laugh and smile. Yeah, strange knowing what's coming, and I've got my coat, my iron coat on, you know, what would they call it? You know, my secret weapon. I'm immune to anything else. Anyway, enough's enough. Tapestry, make it colourful. Enjoy what's around you. Enjoy everything around you. Everybody. So, love you all, as normal, and hopefully see you soon. Bye for now.